Body art practitioners need to be aware of diseases and how to prevent spreading diseases that can be present on certain areas of the skin. The Centers for Disease Control provides the following information on syphilis. Syphilis is a sexually transmitted disease, otherwise known as an STD, that can have very serious complications when left untreated. But it is simple to cure with the right treatment. When a pregnant woman has syphilis, the infection can be transmitted to her unborn baby. Depending on how long a pregnant woman has been infected, she may have a high risk of having a stillbirth or giving birth to a baby who dies shortly after birth. Untreated syphilis in pregnant women result in infant death up to 40% of most cases. A person can get syphilis by direct contact with a syphilis sore. The most common mode of transmission occurs from direct contact with a syphilis sore during vaginal, anal, or oral sex. You can find sores on or around the penis, vagina, anus, in the rectum, on the lips, or in the mouth. The average time between acquisition of syphilis and the start of the first symptoms is 21 days, but can range from 10 to 90 days. Syphilis is divided into stages: primary, secondary, latent, and tertiary, with different signs and symptoms associated with each stage. A person with primary syphilis generally has a sore or sores at the original site of infection. These sores usually occur on or around the genitals, around the anus, or in the rectum, or in or around the mouth. These sores are usually, but not always, firm, round, and painless. Sores usually last 3 to 6 weeks and heal regardless of whether or not the person receives treatment. Even after the sore goes away, treatment is required. This will stop the infection from moving to the secondary stage. Syphilis can also invade the nervous system at any stage of infection and cause neuromuscular and ocular problems, such as paralysis and even blindness. Symptoms of secondary syphilis include skin rash, swollen lymph nodes, and fever. This stage usually starts with a rash on one or more areas of the body. The rash can show up with a primary sore, is healing, or several weeks after the sore has healed. The rash can look like rough, red, or reddish-brown spots on the palms and of the hands and or the bottoms of the feet. The rash usually won't itch, and it is sometimes so faint that you won't even notice it. The signs and symptoms of primary and secondary syphilis can be mild, and they might not be noticed. Without the right treatment, infection will move to the latent and possibly tertiary stages of syphilis. The latent stage of a syphilis infection is a period of time when there are no visible signs or symptoms of syphilis. If you do not receive treatment, you can continue to have syphilis in the body for years without signs or symptoms. Tertiary syphilis is associated with the severe medical problems that are related to it. It can affect the heart, brain, and other organs of the body. Tertiary syphilis is very serious and occurs 10 to 30 years after an infection began. In tertiary syphilis, the disease damages the internal organs and can result in death. A doctor can usually diagnose tertiary syphilis with the help of multiple tests. Syphilis can be cured with the right antibiotics from a healthcare provider. However, treatment might not undo any damage that the infection has already done.